So, of course, this is a projection, and it's a projection based on using very much what's happened in Italy and then looking at all the models. And so, as you saw on that slide, that was our real number, that 100,000 to 200,000. And we think that that is the range. We really believe and hope every day that we can do a lot better than that, because that's not assuming 100% of every American does everything that they're supposed to be doing. But I think that's possible.
Over the next 2 weeks, you said the next 2 weeks are going to be very painful. Is the bulk of this going to happen over the next 2 weeks?
You have an upslope. So as mortality, the fatalities to this disease will increase, and then it will come back down, and it will come back down slower than the rate at which it went up. And so that is really the issue, how much we can push the mortality down.
Yeah. So our hope is to get that down as far as we possibly can. The modeling that Dr. Berg showed predicts that number that you saw. We don't accept that number that's what's going to be. We're going to do everything we can to get it even significantly below that. So, I don't want it to be a mixed message. This is the thing that we need to anticipate, but that doesn't mean that that's what we're going to accept. We want to do much, much better than that.
But doctor, when we look at the curve, it goes much further in time. So we would have deaths and cases for much longer. I mean, we do expect...
So you can put up slide number 2. So that's a generic... I'm sorry, if you can go back to the slides and put up slide 2. Okay, so what I showed you was a generic picture of what happens in an epidemic when you mitigate. So no mitigation, mitigate. This is based on the experience around the globe with this particular virus. And so it does have a tail, but the peak you can see by this projection, and this is the IHME data, the peak is over the next 2 weeks, and this is tracking mortality, so the number of fatalities from this virus. And so that's the part that we think we can still blunt through the superb medical care that every client is receiving, but also even more stringent people following the guidelines.
I can't see the small characters, but are we seeing deaths until June? I can't really...
This is June.
This is June, so we would still see problems and deaths in June.
It's a projection.
It's a projection, of course.
So, just getting back to what I said about the stepwise thing, deaths always lag. So you will be seeing deaths at a time when, as an epidemic, we're doing really, really well, because the deaths will lag.